What does grief therapy look like? I think that's a really interesting question, and not the easiest one to answer straight away, but I'm going to give it a stab. So, as many people be aware, grief assumes many forms and can sort of manifest itself in many different ways. It can be from emotional outpouring, which is quite common, but to the point where it feels uncontrolled or uncontrollable. It can be the opposite. It can be a lack of emotional feeling, almost feeling numb inside, and an inability to express ourselves. That's quite normal as well. And it can also affect our day-to-day capacity and functioning, so ability to get out, work professionally, complete routine tasks, that kind of thing. So it can impact many aspects of our lives. But broadly speaking, what we see is acute loss and what's called prolonged grief, commonly previously known as sort of chronic or complex grief. And acute grief is quite understandable. It's typically something that will take place over the course of the first 2 or 3 months of your loss. That's not to trivialize it at all, just to normalize things and sort of try to explain what's going on. And then we have what's called complex chronic, or is now termed as prolonged grief. And that's an interesting one because that's when the grief and those symptoms continue as you would expect for a prolonged period of time. And for many, this can be something really debilitating in terms of emotional expression or getting on with those day-to-day aspects of your lives, and it can last for years. It's interesting because grief has only been medically recognized in the DSM-5, or the Diagnostic Statistical Manual, in the last 3 years, just over 3 years. March 2022 was when it was recognized. I mean, that sounds a little bit strange, obviously, because we've all intuitively understand that grief is problematic and can certainly require support, if not professional support. So what does that mean? It means it's all at quite early stages in terms of what there is in terms of therapeutic support. I mean, traditionally, people looked at the work of someone like Kubler-Ross and looked at the 5 stages of grief: anger, bargaining, sadness, depression, and acceptance. However, that's as instructive and important as Kubler-Ross's work was. It's developed a long way since then. And there's an understanding of what I've referred to, essentially the dual process model, where you look at loss-orientated stress and rest-orientated stress. And that's looking at the emotional side and the practical side and the implications of grief. So when we experience acute grief, that's quite understandable and normal, as I mentioned. And in those scenarios, therapy certainly can be helpful. But would I say it's absolutely necessary? No. The likelihood is that you will come out the other side, so to speak. However, it certainly can be supportive. And to sort of give it some context, typically about sort of 85% on the sort of current reading figures. It can vary a little bit. Say that most people will experience that sort of acute grief when you lose a loved one. However, prolonged grief, when it goes beyond a year, according to the DSM-5, although a recent NHS study looked at prolonged grief from the context of beyond 6 months. So it does vary in terms of what our understanding of the length of time that is before it qualifies as prolonged grief. That demonstrates that therapeutic intervention would be really supportive in those circumstances. And thankfully, understanding the work of Strobe and Schutt, who, I hope I pronounced that right, who came up with the dual process model, and how it's been advanced by the likes of the Centre for Prolonged Grief, which now provides an evidence-based 16-session sort of treatment plan. That sounds quite formulaic, but it is quite remarkable actually, some of the things that they work on, and I'll talk a lot more detail about that in time. But essentially, if it's going beyond that period of time, then it's certainly something that would benefit from therapeutic support. So if you're experiencing these symptoms of it impacting your day-to-day life, your emotional well-being, then I would seek therapeutic support in that instance. If you're experiencing acute grief, therapy can be supportive, and we can help process emotions, and we can look at ways to maintain connections, what's called continuing bonds, that kind of thing, to create a really, and this is going to sound a little bit ironic, healthy, supportive system in terms of integrating grief and potentially finding meaning. Thank you.